among these great and very passionate subjects is now the next great debate, healthcare. And frankly, I appreciate the President's leadership on this, because he has made it very clear this is the next great national debate. And as soon as he said that, and he said all the cards are on the table, everybody got really, really nervous. Because some people thought they had already had a reserve placard. And come to find out that wasn't the case, because this President's method of operation is to take all 52 cards and throw them up in the air and say, okay, now we start the debate. I happen to be the national co-chair of National Universal Healthcare, myself and John Conyers. I signed on in 676. This is not socialized medicine. It's not English care. It's not Canada care. It is, at its core, exactly what every member of Congress has already given themselves. So, where do we go? The immediate concern of the Single-Payer Healthcare Coalition, which counts among their allies some 17,000 physicians in the PNHP, the Physicians for National Healthcare Policy, are mobilizing to ensure that what's called the public option stays part of the plan. And that means that you can basically buy into Medicare. Now, at any age. No matter what we do, let me just make it very clear, it won't be free. There's no such thing as free health care. We will pay for it. The question is, how is that burden distributed, and on whom will it be distributed? Right now, this country is the only nation in the world that has health care tied to point of employment. And we are seeing with great distress what happens in that kind of a system. So 600,000 some odd people a month are suddenly finding out that they're without health insurance. But we're the only country that does it that way. There is virtually no portability. So the President has outlined some broad goals for the debate. One of them is that the healthcare system must be portable. 2, it must be opt-in. We will not see a top-down, federally mandated healthcare program. Not going to happen. It will be the opportunity for us to select what we think is best for us. I'm fighting to keep the public option part of that. Now, I met with the executives of the for-profit private health insurance companies, and they said, you can't do that. You cannot have a Medicare option. And I said, why? And they said, because it's unfair. Medicare delivers health care with less overhead more efficiently than we can as private health insurers. To which I said, that's the point. But because of a uniquely American ethos, we are going to have a combined system, at least initially. I don't know what it's going to look like. Nobody does at this point. Anybody tells you they do, doesn't know. This President has laid out some priorities, some goals. It's about a 6-month debate, but I can tell you this, we will pass a national health care policy that gets delivered health care to every American in this country by December of this year. It will happen. Whatever it is, when it comes to a vote, it will not be perfect. And I will vote to support it, even though there will be things in it I don't like. Because the status quo in health care is killing people. 50 million Americans without health care. Won't work.